Is our healthcare system in crisis because of the winter surge? Maine and a few of the other states, New Hampshire, Massachusetts, I've seen stuff going on. I know my sister is out in California and they started a new mask mandate. But regardless of if you're vaccinated or not, you have to wear a mask when you go anywhere in public. So there's that, and they're going to be pushing a lot more of this, and we need to be prepared for what is to come. I think that there will be more mandates, more closures, more everything that we've seen over the last 2 years. This is not going to stop. It's not going to stop anytime soon. As long as they can push this, they're going to. And there's all this stuff on the news right now about the healthcare crisis and all that. And yes, we are short hospital beds here in Maine, and there are a lot of COVID cases. I have a personal family member that currently has COVID. He's doing quite well. He's only got a couple of symptoms, but he feels pretty good. And there is a shortage of beds right now, but a lot of this is, you know, it's created. It's our state, and I know other states have done it too, is mandate the jab for healthcare workers. And a lot of healthcare workers are out of work right now because they were good enough to do the work for a year and a half, and now all of a sudden they are being forced to get this jab. So over the last couple of months, we have lost a lot of healthcare workers in the field, and we have seen hospitals, local hospitals all over the state, shutting down trauma units, things like that, because they don't have enough people to keep all the units open, so they're shifting people to keep just certain ones open. And once they do that, we've got all these issues. We don't have enough beds in nursing homes because mandated the jab. People left their jobs, they were fired, or they quit on their own. But this is what this system is creating. I mean, this is not just, this wouldn't happen all on its own. Without the mandate, we would have more healthcare workers. We would have more available beds. It wouldn't be such a problem. A couple of weeks ago, our governor here in Maine called in the National Guard to help fill some vacancies and help, you know, make it easier for everybody around in the nursing homes and hospitals and things like that. I know different states are doing different things, and as this progresses, and I think it's going to over the winter, COVID will get worse, just like the flu always gets worse in the winter. It's one of those things we need to be prepared for. We need to make sure that if mandates come in effect, are we prepared for that? Whether it is lockdown mandates, mask mandates, mandates at work. I think the dog has to pee. So making sure we're prepared, pantry stocked, everything we need, ready. If we lose a job, we lose a job. There are other jobs, hopefully, and other things that we can do to help support our families. Being prepared for this kind of situation is super important. I know I lost a job years ago, and I was sort of prepared. I had plenty of food, which was nice. We had our food pantry started, and we were able to get through quite a while I looked for another job. And it really was helpful having that food pantry. But being prepared in every way possible in this circumstance, any type of mandates that come down the pike. And I think we really need to look at all these different scenarios. This is definitely going to get worse, and the government is going to push more and more as much as they can, because they can. So I just wanted to make a quick little video today about this healthcare crisis, and that we really need to pay attention to what's going on and be prepared for what they're going to send down the road to us. And that is it for today. If you like this video, give me a thumbs up. Subscribe. I'll see you in the next video. Bye.